Let's talk about psoriasis, a pretty common skin condition that's easy to recognize once you've seen it. You'll usually notice silvery scales or red plaques on the extensor surfaces like the elbows or knees. Remember to check the nails for nail pitting or uncal lysis. Don't forget that about 20% of patients develop psoriatic arthritis, which can show up on imaging as the classic pencil and cup deformity. Diagnosis is usually clinical, but a skin biopsy can help confirm it if needed. Psoriasis treatment entails topical steroids as the first line. You can add emollients to keep the skin hydrated, and salicylic acid can help soften the scales. In more severe cases, you might consider phototherapy, which helps slow the rapid skin cell turnover. It is great for widespread plaque psoriasis. You can add on retinoids, which help normalize skin cell growth. This is useful for thick plaque and pustular-type psoriasis. Biologics are used for moderate to severe psoriasis, especially if there's psoriatic arthritis. Pimp question for biologics? Remember to screen for TB, Hep B, and C.